Hello, I'm Dr. James Bogash, expert in health and longevity, as well as creator of Bogash Life and Balance. And as a practicing chiropractor for 23 years now, this particular study obviously strikes home, and it doesn't come as a big surprise. What it may come as a big surprise to are the insurers out there who don't want to pay for this. But um, the researchers looked at a very large chunk of both almost 1,400 chronic low back patients and over 1,200 chronic neck pain patients across the variety of clinics in North America. And they looked at whether there was improvement over the course of 3 months and what kind of frequencies that these patients sought chiropractic care for. And overall, there was definitely an improvement, nothing dramatic, but definitely an improvement. And it seemed like the people that had more severe pain, more disability, ended up going to the chiropractor more frequently. And that certainly makes sense, because if something's helping, chronic pain is not an easy thing to manage. And less visit frequency is going to be a harder time to get around chronic tissues and contracture tissues that may respond temporarily. That being said, there are two things to consider. Is that, first of all, there's always been this strange group of people who seem to think that chiropractic care has no research behind it, and that completely flies in the face of a large body of literature that suggests that chiropractic care, the average chiropractic care visit, is effective. And that doesn't include the providers like myself that do a lot of other things above and beyond, and how much we impact by lifestyle choices and recommendations and home care instructions. Like, you just start adding those into the mix, and it certainly makes sense. And to call chiropractic unscientific anymore, just those people aren't actually reading the science, which I find ironic. The other thing to consider, anytime it comes to chronic pain, there is no panacea, there's no miracle drug, there's no miracle treatment, there's no miracle procedure that's going to get you out of pain. It's going to require a large effort on your part to manage this. I can't tell you how many times a week I have conversations about patients needing to do things like yoga or Tai-chi, or just to get moving. Moving in and of itself is anti-inflammatory, but if we're going to loosen things up in the office, I need you to be out there moving so that things don't lock up again. To just use any particular treatment, whether it's chiropractic, whether it's massage, whether it is yoga by itself, whether it is pain management or injections or drugs, none of them are going to provide you the relief that you think they are. It needs to be a multimodal approach to truly get people better and move beyond their chronic pain. Can't forget to throw in mental health component of that. So I'd say cognitive behavioral therapy, but that's just because it has the most research behind it. But if you really want to manage your chronic pain, stop looking for a single answer. I do strongly believe that chiropractic care is one part of that answer, but you need to use that chiropractor as a tool, as an educator, as a coach, to find out what else you need to be doing. But I guarantee that there are things that you need to be doing, and movement is a huge chunk of that. Diet becomes a very important player. Mindset becomes an important player. But you need somebody to act as a coach to get you past this stage in your life. And I guarantee I've seen it often in my life, often enough in my practice to know that when all those pieces are in play, that patients can have a much greater quality of life. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.